Severe physical pain is virtually all that 8-year-old Sonu has known for the last several months. Severe convulsions and frothing have become part of the routine, and his parents can do little to help him. It has turned for the worse in the last months since he was diagnosed with Japanese encephalitis. What started with nausea and stomach pain has turned into a much darker nightmare.
कहते हैं कि डॉक्टर ठीक हो जाएगा, फालिज मारे ठीक हो जाएगा, घबराओ मत, बहुत जल्दी ठीक हो जाएगा, परेशान मत रहो। हमने इसको पूरा इसको आशा निशा सब छोड़ करके इसे यहाँ पर आते हैं अभी हम लोग।
I am standing in Japanese Encephalitis or JE ward of Baba Raghav Das Medical College of Gorakhpur. And as you can see, more than 100 children having the disease are struggling to survive in this ward. Like swine flu, Japanese encephalitis has its origin in pigs and is transmitted to human bodies through Culex mosquito.
Sonu is not alone. The entire ward is filled with patients like him, mostly children. 3-year-old Akash has been here for the last 25 days. Doctors say there is no cure. He is in the last stage of the disease. It is not that encephalitis is new to eastern parts of Uttar Pradesh, especially districts like Maharajganj, Kushinagar, Sant Kabir Nagar, Deoria, Siddhartha Nagar, Basti and Gorakhpur. Since the first outbreak in 1978, the disease has become an annual affair in these areas. Records say nearly 10,000 people have died of encephalitis in the last 25 years. Consider the figures for Baba Raghav Das Medical College in Gorakhpur. 4,752 patients were admitted in 2005. 1,135 of them died. In 2006, out of the 2,029 patients admitted, 437 died. In 2007, 547 of the 2,729 patients admitted for encephalitis died of the disease. 512 out of the 2,100 patients admitted in 2008 died. This year alone, 208 patients have succumbed out of the 894 admitted here so far. 150 children are undergoing treatment for Japanese encephalitis at the hospital, the only one specializing in the treatment of the disease. And infrastructure available leaves a lot to be desired.
एक ही बेड पर 2-2, 3-3 बच्चे हैं सर। रात में हमें नीचे सुताना पड़ता है इन लोगों को। और यहाँ का जो व्यवस्था है सर, वो डॉक्टर लोग खुद नहीं चाहते हैं कि मरीज को रखा जाए। वो रखने से कतराते हैं। अच्छी व्यवस्था नहीं है इन लोगों के साथ काम करने का।
Despite the specialization tag though, there is no specific line of treatment for encephalitis. Doctors here put it down to hit and try out of research on the subject.
Vaccination and fogging is a domain of the health department. I, as the principal of the medical college, trying to manage these patients, trying to produce, give them drugs and the better infrastructure to treat the patient. Simultaneously, with our collaboration with the NIV, we are going the research work and the further things by which we can do better management.
Rising public anger is the result. Relatives of patients suffering from Japanese encephalitis say swine flu hogging the limelight means nothing is done for their plight. Though Japanese encephalitis remains a far bigger killer and a far bigger issue of concern. Patients of the disease are even refused admission on the basis that there is only place for swine flu patients.
Swine flu पे तो इस समय बहुत हल्ला है, लेकिन इन्फ्लाइटिस पे एकदम कम हो गया है। उसका तो एकदम हल्ला ही खत्म हो गया है, लेकिन हर साल यहाँ मेडिकल कॉलेज में हर साल पता चलता है कि बहुत सारे बच्चे मारे जाते हैं इस बीमारी से।
The silent killer Japanese encephalitis is killing hundreds of children in eastern parts of UP every year. And those who survive are left with neurological disorder. This year alone, Japanese encephalitis has killed more than 200 children in eastern parts of UP. And if you compare this data with the number of deaths caused by swine flu across the country, you will find that J is more fatal. Ironically, nothing much has been done to check the deaths caused by Japanese encephalitis. In Gorakhpur, with Naveen Lal Suri and camera person Gopal Choudhary, this is Anurag Tripathi for NewsX.